We're getting a much more detailed picture of COVID-19 cases here in the city of Toronto. Up until this point, we've known that it has hit low-income residents and new immigrants to the city. Now we know that some areas are harder hit than others. This is the map that the city has put together. It shows the highest number of COVID cases in the northeast and the northwest parts of Toronto. Places like the Rouge community has 400 cases. Another 384 people living in the Mount Olive area who have tested positive. There seems to be fewer numbers in the central and downtown neighborhoods, but Dr. Davila says the virus does travel.
Where a person lives does not necessarily indicate where they picked up COVID-19. The reality is that you are at risk of getting COVID-19 anywhere when you are in close contact with the respiratory droplets of someone who is infected with the virus. Second, looking at a map of cases, people may mistakenly believe that there is an elevated risk of infection by going to certain parts of the city. This, in turn, contributes to misinformation and unintended stigma.
Dr. Davila did say that the Toronto Public Health is using the data to help better educate people and perhaps encourage others to proactively get tested. The city can also draw further information about living conditions and types of employment and how that might be contributing to people being exposed, according to Mayor Tory.
The data is the data. What I think is more important than the data itself is what you do with it. And I think this represents a huge opportunity for us to support people better, to help educate people better, any of the requirements that might exist to help stop the spread of this virus and to help make sure that all of the people of Toronto understand what we can do collectively to make sure that it stops spreading everywhere, but particularly in places where we've seen a disproportionate number of cases that reside in those areas.